Next is Rachel Foster.
Hello, my name is Rachel Foster, and I am a 32-year-old detransitioned woman. At 21, I was diagnosed with gender identity disorder, as it was at the time, and spent the next 5.5 years taking synthetic testosterone. I was told by my psychologist and by my general practitioner she referred me to that if I did not take this drug, I would kill myself. Within a few weeks, I went from talking with my psychologist to being prescribed synthetic testosterone. I was discouraged from seeing an endocrinologist and was told all effects except hair growth and hair loss were reversible. This was a lie. My provider failed to assess risks based on my medical history or, in fact, critically analyze whether I was fit to consent or if there were more psychological reasons for my distress around my sex. In addition, my therapist lied on documentation to say that I had been her patient for far longer than I had been and that I had no pre-existing conditions that might affect my gender identity disorder diagnosis. There are many compounding factors for why I felt wrong in my body. At 17, I was diagnosed with schizophrenia with major depression, now diagnosed as schizoaffective disorder. I also have a history of sexual abuse and trauma. I disclosed these things to my psychologist and prescribing physician, but was still told that I needed to transition. At the age of 26, I began to experience renal failure. I was jaundiced, vomiting, and urinating blood. The only drug I was on at this time was synthetic testosterone. I saw a new practitioner who suggested I stop the injectable synthetic testosterone in exchange for a topical version at a much lower dose. My symptoms improved. At 27, I stopped altogether. Shortly after, I experienced the first of 3 transisemittic attacks, also called mini strokes. Then at 28, I was diagnosed with endometriosis and adenomyosis. At 29, I lost my uterus and my cervix to the disease and had a hysterectomy. After the operation, I discovered that my vaginal tissue was excessively thinned and weakened by testosterone use. I had multiple tears, which led to infections. I also learned that my ovaries no longer function, and I am on supplemental estrogen. Today, I implore you to consider the risks these medical experiments have and stop this method of treatment. We cannot consent to treatment as experimental as this. No one, child or adult, should have to go through the constant health battles I've been through. Instead of my mental health being taken care of, I was sold a medication that has left me with physical pain, emotional trauma, and the same mental illness I had before. Medical intervention should not be taken to affect emotional distress over one's body. Thank you.
Thank you, Ms. Foster.